and to be able to have a mainstream telehealth platform in Mexico and Latin America, you need to have a very simple experience. And for it to be like super straightforward. And because we've been able to have patients from 50-year-olds having psychological consultations and 80-year-olds sitting at their senior homes and being able to talk to a geriatric doctor, that's how we've been able to prove also that our platform is very simple and the user experience is very good.
Hey y'all, it's Simmy. I had the chance to learn about the featured startup HelloDoctor at SoftTech Venture Studios Demo Day this month, December of 2022. Jaco Luchtan, the co-founder and CEO, and his team are tackling a broken healthcare system in Latin America. Tune in for the presentation of this ambitious project, followed up with a Q&A with investor Prithviraj Singha. Enjoy.
Yeah, that started a couple of years ago. At my last company, where I was able to sell it to another fund, I was able to see the big problem that we have in Mexico and Latin America about the bad quality and access to healthcare. So HelloDoctor was born with the idea of democratizing healthcare in Latin America, and this is a little bit of what it looks like. No, so 92% of the population in Mexico only have access to public healthcare, and these are pictures that I took with my phone of a hospital that is right next to our office, and these are lines that you see every single day. So this is the nightmare they have to go through. It takes them up to 4 days to see a practitioner, and once they manage to get a prescription, 37% cannot get fulfilled because there's not enough medicines in the public hospitals. So the healthcare system in Mexico is completely broken, and then people have to, in order to avoid going through this, they go and pay out of pocket for their care in private clinics and hospitals. So after seeing this, we developed a system and flipped the script where we hired the doctors and we paid them per successful consultation. They in turn take video and chat appointments where we provide end-to-end care from the first symptoms to delivering your prescriptions and labs right to your door. But a challenge is that virtual healthcare is still very new in Latin America. It hasn't matured as much as in the United States. It doesn't have big players like Teladoc, like in the United States. So based on this, and because our target is for people to see HelloDoctor as their first step into healthcare, they need to gain trust and loyalty. That's why we removed all the barriers and released a completely free virtual primary care service, where with only your smartphone and internet access, you can talk with a general practitioner, a nutritionist, a physiotherapist, a veterinarian, and a psychologist. And you can do this for free over and over again on a seamless experience through HelloDoctor. And that's how we're becoming the first step into healthcare for many Mexicans and people in Latin America right now. This service has allowed us to provide more than 20,000 consultations in the first year. We've been able to double our user base every couple of months, where we have more than 40,000 active users already. And we have success cases in 15 countries of Latin America. The reason for this is that when we first released the app, we released it in the whole continent, and we added a couple of marketing ads campaigns on different countries of Latin America, and it started to work, and patients started to get the platform and get consultations. So we've proven our initial product market fit because we've been able to provide service from patients from 15 years old to 80-year-old in many countries of Latin America. So it's an experience, and it's an improvement that we can apply into many countries. And this is a little bit of how we've been growing in the last year. Something that's interesting is that our month-over-month consultation growth is 50%. So last month we were able to provide 3,500 consultations, and the month before that, half of that. So we've been growing a lot, and we already have revenue. One of our revenue streams is selling different projects to pharmaceutical companies, where we already have contracts with Lilly and Pfizer. With Lilly is a contract for diabetes patients, and Pfizer is a contract for migraine patients. What we do is we design digital patient journeys where we provide end-to-end care to these patients, and then gather different data points with these specific types of patients of these specific types of conditions. And then these data points, we share them with the pharmaceutical companies on an anonymous way, because we're completely compliant with HIPAA laws, right? So we only share like overall data of what's going on. And this is a little bit of how we've been growing and what we've been doing. We found a way that we developed a product that the technology is proprietary. We built it ourselves, all the video calls, all the chat systems, everything. And that's how we've been able to provide $3. It only costs us $3 per consultation. So we also found a medical team that is very, very good, and that they have availability on their schedules, and they're able to provide us with consultations that are very, very cheap. And they are very happy because these are doctors where they have been able, we're giving them more than 500 patients each month, where they are providing real consultations with real patients from all of Latin America. And there's some doctors that are even winning $1,000 a month or $1,500 a month only from our service. And this is all sponsored by the HelloDoctor Foundation, which is the revenue stream that we designed in order for the free primary care service to be sustainable. And the HelloDoctor Foundation is supported by different benefactors that we call angels, that are non-profit organizations or different companies. So what we're trying to do is, what we're building is a virtual healthcare marketplace that takes in account all the different stakeholders, and that is completely focused on the patients. So right now we already have pharmacies connected, labs connected, and they're able to deliver their services to patients in all of Mexico at this exact moment. And obviously the size of the market only from virtual consultations is huge, which in this year is 9.8 billion. It's gonna grow 37% in the next 4 years. So only from the virtual consultations, it's a huge market. If we take into account everything that we can sell from prescriptions and labs, it's a very, very good opportunity. So the way that we make money is that by creating a critical user mass with a hook that is a primary care service, we're able to then monetize some of these users by selling them their prescriptions, their lab tests. They can pay for follow-up consultations with specialists. We have more than 1,000 doctors using HelloDoctor as their digital office, and using it as to give service to their patients. So if you get a primary care consultation with a general practitioner, you can then get referred to a pediatrician and find a pediatrician in HelloDoctor and pay for that consultation, and we take a small cut from that. We're also about to release our first health subscriptions, which in January, we're gonna release the mental health subscription, and in February, we're gonna release the diabetes subscription. Why these two conditions? Because the way that our plan was designed from the beginning is to release a service that was very broad, very general. General practitioners taking broad consultations. And what we've seen is that the most amount of the types of consultations that get the most amount of recurrency and follow-up sessions are for mental health, psychology, and diabetes, because Mexico is the #1 country in the world with diabetes. So because of these two reasons and how we've been able to talk with users and read our user behavior, we're gonna release these subscriptions. And fortunately, we already have users on the platform that are willing to pay for them. So as soon as we have them developed and designed, which will take us 1 or 2 months more, it's gonna be a very easy to prove revenue stream and to prove the unit economics in a very appropriate way. And these are 3 scenarios that we made from the subscriptions specifically. On the base scenario, we think that by the end of 2023, we're gonna be able to have 700,000 active patients. And by only converting 0.27% of these patients, we're gonna be able to have $1 million in revenue, which is going to give us a $4 million enterprise valuation. And this comes from the HealthTech revenue multiple of 4.5, which is an average of 15 companies that are public that we researched. So the idea is, on a base scenario, to have a $50 million valuation from the revenue stream of only the subscription services. So if you take into account what we can make from selling prescriptions, selling lab tests, selling follow-up consultations, and all the money we can get from the pharmaceutical companies from selling some of this data, it is a project with a lot of potential. Also, Roy, if you want to interrupt me with questions, go ahead. Don't worry.
I do have.
I'm sorry, you got cut off.
Yeah, can you hear me now?
Yeah.
No, do the pitch as you're doing it, because it's being recorded, and I'll ask questions after you kind of go through everything.
Cool. Right. So that's what we do with B2C. We have another product that we developed for B2B, which we call it TAS, Telehealth as a Service. And this is a product that we developed by accident. I have a very good friend in Mexico that she has an app for wellness. And they wanted to add a telehealth service on their platform. So we developed it for them. And when we finished, we realized that we could do this with several other platforms. So we developed a system, a plugin, where you can add into any app. And in a couple of weeks, you can provide video consultations with your own label, into your own app, using our doctors and our infrastructure. So this is a product that we're currently already selling. We have like three, four users at the moment, 3-4 enterprise customers at the moment. It's a product that we just finished developing a couple of months ago, and it's how we're targeting the B2B. No. Obviously, we're not the only ones doing this in Mexico and Latin America. There's several other competitors. This is a very simple competitive landscape that we made, and where we compare how simple and good our platform is and the user experience is to other platforms, and if the app has a specialized focus or is an end-to-end care service. What we mean by end-to-end care is that we provide you the service from the first symptoms and giving you the consultation to even delivering your prescriptions and labs to your door. For example, Dr. Alia, which is a specialized focus platform, they're only a directory of doctors. So we made this matrix from also talking to several users and conducting several focus groups, and we realized that our app was the easiest to use, which we think it's very important in order for it to not be a barrier in Latin America. We've been able to achieve all of this with only $600,000 we raised from pre-seed. This $600,000, 85% was put in by me and my other two co-founders, and the other 50% by another company that they are called LifeMed. They're from Mexico, and they do education for doctors. They have more than 160,000 doctors on their platform. So we're piggybacking on their database in order to onboard more doctors every day. Two key points is that we've been able to achieve all of this by only spending $30,000 in marketing. So how I've been trained all of my life in my other businesses is that we're very capital lean, and we spend where we need to spend. So that's why we've been able to do so much with only $600,000. And right now, after going through the HealthTech accelerator, we launched our seed round last week, where we're raising $2.5 million. And how we're gonna use these funds is by growing our team in order to improve our product. Our target is to reach 2 million unique users by the middle of the year of 2024, so in 18 months. And we're trying to target to get at least $1.5 million in revenue from the different services that we're releasing every day, and that we can prove revenue from them. And this is a little bit about the team. These are my two co-founders. Daniel was a senior developer at Amazon. Then he was a principal engineer at Nox CRM. They're a prop tech company in the United States. They were just acquired a couple of months ago for $350 million. And Daniel had a little bit vesting on that company. And Salvador his family has a company where they manage 1,500 employees in Mexico, and he's the chief strategy officer. I'm the CEO. I already have 2 exits in other 2 companies. My last company it was a security technology distributor in Mexico. We had a $20 million annual recurring revenue, and I was able to sell it in March 2020, so right before COVID. And here we have a Jaime and Carlos. They are one of the pillars of the company. Jaime is in charge of the quality of our doctors that is crucial for a company like ours to succeed. And Carlos is the one who manages to put HelloDoctor into everyone's phones. So he's the head of marketing. And that's a little bit of what we do. And we would love to make a collaboration. And that's a little picture of the team. A couple months ago, we already have more people than our mascot. That's who we are.
Awesome. Thank you. Very helpful, Draco.
Yeah.
Simmy, do you want to keep recording or pause? I can dive into questions. Whatever you'd like. You're on mute, Simmy. Still on mute. Sorry, I missed that.
I'm sorry, man. Classic. I would like to keep recording because I bet your question.
Okay, great. But so first of all, this is great. Thanks for thanks for walking through this. I mean, I think I think certainly, right, like a service like this is absolutely needed for for people in Mexico. I mean, I think those lines are similar to what I've seen in other countries that are not in the U.S. In India, for example, like similar system. I assume there's not much health insurance coverage, and most people are paying out of pocket for healthcare services in Mexico. Is that a correct assumption?
Yes, that's right. So the insurance companies in Mexico work very, very differently. So everything is through reimbursement. Very few, only if you have like cancer or a big surgery, there's like the deductible or the copay. So people are used to like 40% of all of the healthcare expenditure in the country is made out of pocket. So it works very differently than in the United States. That's why it's a very big opportunity for a platform like ours. They're used to paying it.
Got it. Yeah. Okay, that's helpful. So maybe I'll dive into some questions I had as you were going through the pitch, which you did a great job on that as well.
Thank you.
The story definitely resonates. So that's great. Explain the HelloDoctor Foundation to me again. Maybe I missed that. Like, what role does that play in the company?
Yeah. So something that's very important is we have this free primary care service, right? And a question that we had is that this free primary care service costs me $3 per consultation. So if I want to provide 1 million consultation, it costs $3 million. No, and there comes a time where you like, how much freemium can you give? No. So an idea that we had is to set up a foundation and raise money from nonprofits and different companies that support our vision of democratizing healthcare in Latin America, and for people to be able to talk to a doctor from their homes and do our service. And the foundation is the sole provider. Like they're like the foundation is the revenue stream that supports our free service. So that's how we've been able to. We raised this year $60,000 from different nonprofits. And this $60,000 sponsored 20,000 sessions. Next year, we want to do 150,000 sessions, so we need to raise $450,000. So it's a way for us to justify being able to have a free forever service, as long as the foundation business model works, right?
Yep. So as you think about your revenue projections moving forward, right? Like in 2024, I think you said 2.4 million active patients. I might have gotten that number wrong. That is so. How many visits is that to have 2.4 million active patients?
So something that's important is that for right now we have 40,000 active patients, and we've provided 20,000 consultations. So some of the active patients are people that download the app but don't yet use a service, right? So I think on the project, I think I have to go into my Excel, but I think the projections was that by 2024 to be able to have 2.4 million active patients, and I think it was providing like 700,000 consultations.
200,000. Okay.
Yeah, something like that.
That's,
But,
I mean, I don't need the specific
yeah,
number. Yeah. No, the reason why I bring that up is, right, like you're raising, $2.4 million series, seed round right now. For the freemium model, you will need to raise them, assuming 700,000, visits in 2024. Like, you'll then need to raise like 2.1 million for your nonprofit. Is that correct, or is that separate?
no,
Is that like
no,
seed
because
funding?
no, because what I'm saying about the 700,000 consultations are, many of these consultations are paid. So
Okay.
so you get the like I was telling you, the 700,000 consultations are all the consultations. Like, I'm taking into account
Mhm.
the free consultations, the specialist consultations, the consultations that the mental health subscribers are gonna get. Like it's an amount of everything, right? What we think that, like, we envision that we're gonna spend $450,000 in sponsoring 150,000 sessions next year. I think this number raised to like 500,000 in 2024, if I remember correctly. But yeah, like, the foundation is a key component in order for us to be able to acquire users very fast. Like, it's our hack to acquire users in a very cheap way. Right now, our marketing campaigns, they have a user acquisition cost of $1. So everything that we spend on Google Ads and Facebook, we acquire users that install the app and do a session, and that costs us $1. And then it costs us $3 to give the session. So it's very it's very lean. That's how we've been able to grow a lot with little money.
We're at the top.
No, that.
Sorry to interrupt, Roy. Do you have time for a question?
I have time. I have no problem.
Roy?
Yeah, I could do 10 minutes over.
Okay.
I have a few more questions.
Thanks, Jens. Go ahead.
So the reason why I'm asking is just, I mean, do you have the commitments from, the angels and nonprofits and the foundation to fund, $450,000, right? Like 3x that in 2024. I think you said 500K, right? Like that's over, it's over $1 million. That seems like you're kind of raising additional funding on top of like what you need for your business. So like, how do you kind of think about that? And like, how confident are you in being able to continue to raise like increasing amounts of sums of money as the company scales to enable the freemium model?
Yes. So first of all, the freemium model is jet fuel for our acquisition costs. So if all things go wrong and we remove the free model, we continue the business like everyone else is doing it in Latin America, because we're the only one doing it this way. On the other side, one of our advisors is, her name is Sharon. She raised $62 million to make the Memory and Tolerance Museum in Mexico City. And when we were talking with her, it was very hard for her to raise money because she was raising money for a cause that was not very tangible. It was just to make conscience about tolerance in the world and what the Holocaust meant and everything, no? So when we were talking about her about our foundation and she's coaching us on how to raise money, she told us it's gonna be much easier for you because your foundation is tangible. What you're providing is consultations with real patients, with real doctors, with real problems. So we've been able to we were able to raise the $60,000 in a couple of months from different nonprofits, and because this is very tangible and it's a very tangible cause and how we can impact people, and we can prove this with different testimonials. We have more than 500 testimonials from patients. We're very confident that this can be a business, a social impact business that has a foundation on the back of it. And if for some reason in a couple of years we see that it was too complicated, we either reduce it, like reduce the impact or reduce the amount of consultations you can have, because right now it's unlimited. You can get unlimited consultations. There's people having 5 consultations a month because they have a lot of anxiety, for example. We can reduce it in a way that can fit, no? Like right now, I don't have all of the answers for you, but what I can say is that it's a variable thing, no? That you can be as open or as closed as you want it, depending on the results that we have on the foundation fundraising.
Okay, no, that's fair. Cool. Then maybe thank you for that. That's helpful.
Yeah.
Maybe the other question is on the if you wouldn't mind flipping to the revenue slide. Yeah, this one. Great, thank you. What was the multiple you were using for the enterprise values? 4.5x.
Yeah,
yeah.
I have the source here. If you want to see where it's coming from.
No, I don't think to see. I mean, I think like where maybe that seems a little high to me is, TelaDoc currently is trading at like 2x EV to sales, MWell like 1.2x, LifeMD like less than 1. That seems a little high, just based on the current kind of market. You should command a higher multiple, right? Because you have much higher growth than those companies do. But I would just be cautious about that multiple moving forward.
Absolutely, you're completely right. I'm gonna tell you. First of all, I have this multiple because that's what I got from the source, no? And I said, okay, I'm not gonna play with that. But the reason that I think that why not doing this business in the United States, no? Why doing it in Mexico? Because I am convinced that because of the low costs of healthcare in Mexico and how we can make it, the gross profit we can make from our business is much, much higher than if you do it in the United States. So my point of view, obviously you know more about the United States healthcare system, but my point of view is that because everything is, or most of the things are paid by insurance, that's why all of the consultations and all of the cost of healthcare in the United States is so expensive, because the user doesn't, the receiver doesn't pay for that service. Another company pays for that service, which is the insurance company. That's why it costs you $250 for a specialty consultation. So because of the high costs in the United States, companies like TelaDoc and Amwell are having less profit. With us, we can sell our product for half of the price that you get it on the United States, but we have a quarter of the costs. So it's gonna be probably a more profitable business in the future.
Yeah. What is your long-term, I don't know if I missed it, but the kind of long-term EBITDA or profitability kind of view?
Yeah, so our projections that I can show you later, I can share you a data room with all of the information.
Yeah, no, it's fine. Yeah, and if you want to broadly say, that's fine too. I understand.
Yeah, so our idea is to be able to get at least from $80 to $100 million in revenue in the next 5 to 7 years. And we're calculating a gross profit that ranges between 55 to 65%. These are obviously all projections, and no projections are true, but that's the idea. And we have based this on different like assumptions that we think would be true.
Okay.
I don't know if that answered your question.
Yeah, it did. Thank you. And then maybe the final question I had, you talked about the differentiation in the competitive slides. You mentioned like better UX is, you give a better UX than competitors and like end-to-end care. On the simple good UX, how do you measure that? Like, do you have like specific NPS scores you're tracking? Or kind of like what metric helps you kind of define that versus other competitors?
So we did it on a very straightforward way. We do focus groups with patients and doctors every week to test out different experiments. One of these experiments was sitting down a patient and saying, schedule a consultation with HelloDoctor and evaluate, what do you think? And then having the same patient do this with 5 of these platforms. And we paid for that consultations because all of these platforms, I have like a paid service, right? And this was from actual users where we like gave like where we did focus groups with different with different patients, and that's how we realized that the user experience and how we developed our system and our flows was much better than the rest. All of these platforms are very small. Like it's something very important. There's no mainstream healthcare platform in Mexico and Latin America. There's maybe a couple that are very old and maybe are reaching a high amount of users, but these are all very new. Most of the telehealth platforms were born in the last 3 to 4 years. So there's no public data. Like if you ask which one is the best one and how many users do they have, it's not public. They're very small. Just to give you an example, Ike and AXA Caralty, they're two telehealth platforms from insurance companies. They deliver end-to-end care. Their network is much bigger, but you download their app, you go through the experience, and you feel like you're in the dinosaur age. And we think that in order to be able to be pioneers and to be able to have a mainstream telehealth platform in Mexico and Latin America, you need to have a very simple experience. And for it to be like super straightforward. And because we've been able to have patients from 50-year-olds having psychological consultations and 80-year-olds sitting at their senior homes and being able to talk to a geriatric doctor, that's how we've been able to prove also that our platform is very simple and the user experience is very good.
Okay, got it. I think that's all the questions I had for now.
Cool.
Jaco, this was very helpful. Thanks for taking the time to answer them.